Wanna pass your NCLEX? Then let's get started. Today we'll be covering 10 questions on a maternal newborn case study. Mrs. Smith, a 28-year-old prima gravida at 32 weeks gestation, presents to the antenatal clinic for a routine checkup. She reports feeling increasingly fatigued and experiencing occasional dizziness over the past week. Mrs. Smith denies any vaginal bleeding, abdominal pain, or leaking of fluid. Her prenatal labs and ultrasound scans have been within normal limits. Mrs. Smith appears anxious and fatigued during the assessment. Her vital signs are blood pressure 110/70, heart rate 90 beats per minute, respiratory rate 16, temperature 98.6. Fundal height measures consistent with gestational age. Fetal heart rate is 140 beats per minute, regular rhythm. No signs of edema noted in lower extremities. Mrs. Smith reports regular fetal movements. Based on Mrs. Smith's presentation and nurse's notes, the nurse assesses her for signs of anemia, gestational hypertension, or other pregnancy complications. The nurse also provides education on signs and symptoms of preterm labor and encourages Mrs. Smith to continue monitoring fetal movements regularly. Question 1. Which vital sign finding is concerning in Mrs. Smith assessment? Blood pressure, heart rate, respiratory rate, temperature. Pause the video and select your answer. If you chose option B, you are correct. Heart rate 90 beats per minute. While a heart rate of 90 beats per minute may still fall within the normal range, it is slightly elevated. In pregnant women, an elevated heart rate can indicate increased cardiac output, which may be a response to physiological changes during pregnancy. However, it warrants further assessment to rule out any underlying conditions or complications. Question 2. What is the nurse's priority intervention for Mrs. Smith reported symptoms of fatigue and occasional dizziness? Schedule a follow up appointment in 1 month. Advise bed rest and increased fluid intake. Recommend iron supplementation and dietary modifications. Educate on signs and symptoms of preterm labor. Pause the video and select your answer. If you chose option C, you are correct. Recommend iron supplementation and dietary modifications. Fatigue and occasional dizziness can be indicative of anemia, a common condition in pregnancy. The priority intervention is to address the potential cause by recommending iron supplementation and dietary modification to increase iron intake. Question 3. Based on the fetal heart rate of 140 beats per minute, what is the nurse's interpretation? Normal fetal heart rate, bradycardia, tachycardia, fetal distress. Pause the video and select your answer. If you chose option A, you are correct. Normal fetal heart rate. A fetal heart rate of 140 beats per minute is within the normal range for a fetus at 32 weeks gestation. Normal fetal heart rate ranges from 120 to 160 beats per minute, indicating fetal well being. Question 4. Which assessment findings suggest the need for further evaluation in Mrs. Smith's case? Consistent fundal height measurement, absence of edema in lower extremities, regular fetal movements reported by the patient, reported occasional dizziness and fatigue. Pause the video and select your answer. If you chose option D, you are correct. Reported occasional dizziness and fatigue. Occasional dizziness and fatigue can be signs of anemia or other underlying health issues that require further evaluation to ensure maternal and fetal well being. Question 5. Which prenatal complication should the nurse monitor Mrs. Smith for based on her reported symptoms? Gestational hypertension, preterm labor, placental abruption, oligohydramnios. Pause the video and select your answer. If you chose option A, you are correct. Gestational hypertension. Mrs. Smith's symptoms of fatigue and occasional dizziness may indicate gestational hypertension, a condition characterized by high blood pressure during pregnancy. Monitoring for signs of gestational hypertension is important to prevent complications such as preeclampsia. Question 6. What is the primary rationale for educating Mrs. Smith on signs and symptoms of preterm labor? To promote maternal autonomy, to facilitate early recognition and intervention, to reduce maternal anxiety, to encourage compliance with prenatal care. Pause the video and select your answer. If you chose option B, you are correct, to facilitate early recognition and intervention. Educating Mrs. Smith on signs and symptoms of preterm labor helps her recognize warning signs early, enabling prompt intervention to prevent preterm birth and associated complications. Question 7. Which nursing action is appropriate to assess for anemia in Mrs. Smith? Measuring fundal height, monitoring fetal heart rate, ordering a complete blood count, checking for pedal edema. Pause the video and select your answer. If you chose option C, you are correct. Ordering a complete blood count. Ordering a CBC is appropriate to assess for anemia as it provides information about hemoglobin and hematocrit levels, which are indicators for red blood cell count and oxygen carrying capacity. Question 8. What dietary recommendation should a nurse provide to Mrs. Smith to support iron intake? Increase consumption of leafy green vegetables, limit intake of red meat, avoid dairy products, increase intake of sugary snacks. Pause the video and select your answer. If you chose option A, you were correct. Increase consumption of leafy green veggies. Leafy green vegetables are rich sources of iron and are recommended to support iron intake during pregnancy. Question 9. Select all that apply. Which interventions should the nurse include in Mrs. Smith's plan of care to address her reported symptoms? Encourage adequate rest and hydration, monitor blood pressure regularly, provide education on signs of preeclampsia, administer antihypertensive medications, schedule weekly ultrasounds, refer for immediate hospitalization. Pause the video and select your answer. If you chose options A, C, you are correct. Encourage adequate rest and hydration. Provide education on signs of preeclampsia. Encouraging rest and hydration can help alleviate fatigue and occasional dizziness. Providing education on signs of preeclampsia is important for early recognition and intervention if symptoms of gestational hypertension arise. Okay, guys, you made it to the end. Question 10. Select all that apply. Which symptoms reported by Mrs. Smith requires further assessment? Occasional dizziness, increased fetal movements, persistent fatigue, vaginal bleeding, severe abdominal pain, difficulty breathing. Pause the video and select your answers. If you chose options A, C, and D, you are correct. Occasional dizziness, persistent fatigue, vaginal bleeding. Occasional dizziness and persistent fatigue can indicate underlying health issues such as anemia or gestational hypertension, requiring further assessment. Vaginal bleeding may suggest complications such as placental abruption or cervical insufficiency and should be promptly evaluated. Click that subscribe button and join us next Wednesday.